The benefits, I think, of the industry to the industry of the new screening tool really are that one is there's now a universal standard, and second that I think it promotes a degree of quality control within the industry, so that for people working outside the industry in the allied health areas and general practitioners, they understand that there's now a universal standard and they know what's being done and they can interact with it more closely. The benefits, of course, in terms of the legal liability issues are important because, again, there's a clearly defined mechanism by which the industry knows what the standards should be. It also allows the industry to become and look more professional in terms of what it actually does, and it also increases the rapport with allied health practitioners and general practitioners. So that also allows the fitness trainers to actually build networks within the industry outside their own scope.
The real benefits that I see, I mean, the priority as far as certainly Sports Medicine Australia, I'm sure that many would agree, that the priorities are, as far as participation is concerned, is really safety and providing a safe and careful environment for people to participate in. So this provides an opportunity, one, for this to be done fairly professionally, consistently and efficiently within the industry to provide that sort of outcome for all participants. The other opportunities that probably exist are the opportunity to create stronger networks so that participants aren't just being looked upon or being supported by fitness professionals, but they're also being drawn into support by other allied health professionals, doctors, physiotherapists, and the opportunities for there to be a much more holistic approach in the industry for participants that are participating in fitness activities. I suppose the tool itself provides an opportunity to have a much more consistent approach with consumers. So that first impression, I mean, we all know that first impressions are really important. If we can provide a consistent approach to participants and to clients, then the likelihood is that the industry itself is going to be looked upon more professionally. So as a standard, we know that providing a good introduction, an opportunity to find out more about a client, and also to identify anything that might preclude them from participating in the way that we would otherwise think they might be able to participate, is a good thing for the industry.
I think consistency of practice across the industry, which provides clients with peace of mind that maybe as they move from professional to professional, assuming they do, that they are going to get a consistent service. They have an increasing understanding of why these things are in the tool and what it means for them. So education for the client, but also that professionalism, that the client can see that the professional is taking an interest in them as a person. So not just, I guess, as an income stream necessarily, and that comes back to not just use of the tool, but then I guess application of it and the use of it to help to educate the client. Look, I think the opportunity to receive referrals or GPs is based very much on their level of trust in the professional, and I think this is a key component towards securing that trust, to show that there are set procedures in place that are used by the fitness professional to screen a client, and that they're aware of what they need to do or should be doing when they do get a client who presents as high risk after going through the questionnaire. And certainly my experience with referrals from GPs and so forth is that that's very important. They're looking for two things, and the primary thing is they trust the practitioner, and the second thing after that is then I guess the results, and that they're getting that feedback and reports, and this again is part of that process. Education, probably. Obviously I'm big on that because I'm an academic, but the education of the profession, but education of anyone who is looking to start exercise, that we are actually providing everybody involved in the process with tools that they can use to educate themselves and better their lives and the lives of their clients.
I think the screening tool is, for me, is really a great opportunity for the fitness industry to connect in a very professional way with their client in the first instance. So it creates a relationship immediately, because you're actually asking that client to reveal certain things about themselves that require a professional consultation. So it really sets the scene that that client will come in and have a great experience with a professional. Also, very importantly, it creates a professional relationship with referring practitioners, whether they be doctors or allied health professionals. It gives them the confidence that the fitness industry professional is actually working in the best interests of the client, and using a standard screening system that's approved by the peak bodies of Fitness Australia, ESSA and SMA is an important indicator to them that the evidence is there, the risks are assessed carefully, and it's a great start in building that relationship. I think there's a lot of positive energy around this, and people are wanting leadership in this area. They want clear-cut indicators of how to build these relationships with their clients and get this information.
The main benefits are probably revolve around the process in itself and the inaccuracy, and having an evidence-based piece that professionals can use with confidence, and knowing that risk stratification will be accurate, and that the appropriate exercise prescription in line with the intensity guideline can be accurate as well. That's particularly important, and it allows for consistency, continuity across the profession. What this does, though, it actually acts as a conduit or a mechanism that can help connect the fitness industry to the broader health sector. A further benefit is that it offers an opportunity as a process for the professional to be able to interact with the client, inform them, educate them, build their trust, and set down a path of what is client-centred service. And that's something that can be particularly powerful for trainers who may not necessarily be doing that very well at the moment. We're going to have a genuine impact on physical activity levels in Australia. It needs to be the public that have an understanding and are educated and know what to expect from a professional and from a service. And this does exist with other professions. If somebody is wanting to have their tax completed at the end of a financial year, they know what to expect with an accountant's service. Whereas with a fitness service, if somebody's been inactive for 20 years, they're not necessarily knowing what they're going to meet with when they first interact with a professional. But if there's a raised awareness across the community, across the health sector, throughout education in regard to the initial steps and the introduction into exercise with a pre-exercise screening system that's national, well, that's a great step.